Good day, everyone. I'm Vina, Vanessa, Nier. Today, I am going to report Part 2, the development of the learners at various stages. There are various stages of development of the learners. And now, I am going to report to you the first two stages of human development. As an educator, we must carefully consider the characteristics of learners with respect to their developmental stage in life. And now we will discuss the Unit 1, the first stage of the development, which is the prenatal period. Basically, the development of learners starts in the prenatal stage. So Module 11, in this module, we will discuss the prenatal development. The prenatal period refers to the period of time from fertilization to birth, and the prenatal development starts with the fertilization in the germinal stage of embryonic development and continues to fetal development until birth. At the end of this module, you should be able to trace the course of the prenatal development process that you went through, explain the most common hazards of prenatal development, and become more appreciative of the gift of life manifested in an anti-abortion stand. Now, let's move on to the stages of prenatal development. The prenatal development is divided into three stages. First one is terminal period, second, embryonic period, third, the fetal period. The germinal period is the first 2 weeks of after conception. This includes the creation of zygote, the continued cell division, and the attachment of the zygote to the uterine wall. The following are the details of the development during this period. In 24 to 30 hours after fertilization, the male sperm or female egg chromosome unite. In 36 hours, the fertilization ovum zygote divides into two cells. In 48 hours, for 2 days, two cells become 4 cells. In 72 hours or 3 days, the 4 cells become a small compact ball of 16 to 32 cells. In 96 hours, the hollow ball of 64 to 128 cells. In 4 to 5 days, the inner cell mass or blastocyst still free in the uterus, and in 6 to 7 days, the blastocyst attaches to the wall of uterus, and in 11 to 15 days, the blastocyst invades into uterine wall and becomes implanted in it, or that is what we call the implantation. The second stage of prenatal is the embryonic period. This is the 2 to 8 weeks after conception. But in this stage, the name of the mast cells, zygote, becomes embryo. The following developments takes place. Cell differentiation intensifies, life support systems for the embryo develop, and organs appear. To make it easier to understand, the embryonic stage is the period from implantation to about 2 to 8 weeks after the conception. During the embryonic stage, the layers of cells are formed. The endoderm, the inner layer, which develops into digestive and respiratory systems, and the ectoderm and the mesoderm, the outer layer. The ectoderm is the outermost layer, which becomes the nervous system, sensory receptors, which is the eyes, the ears, and the nose, and the skin parts, the nails and the hair. The mesoderm is the middle layer, which becomes the circulatory, skeletal, muscular, excretory, and reproductive systems. During the embryonic stage, every organs in the body or organs begins to develop. The second stage of prenatal period is the fetal period. This is 2 months to 7 months after conception. The growth and the development continues dramatically during this period. The details of the development process are as follows. In 3 months after conception, fetus is about 3 inches long and weighs about 1 ounce. Fetus has become active, moves its arms and legs, opens and closes its mouth, and moves its head. The face, the forehead, eyelids, nose, and the chin can now be distinguished, and also the upper arms, the lower arms, the hands and the lower limbs. The genital can now be identified as male or female. In 4 months after conception, fetus is about 6 inches long and weighs to 4 to 7 ounces. Growth occurs in the body's lower parts, and the prenatal reflexes are stronger, and mother can feel the arms and leg movements for the first time. And in the 5 months after the conception, fetus is about 12 inches long, weighs close to a pound, and structures of the skin, the fingernails, the toenails have formed, and fetus is more active. In 6 months after the conception, the fetus is about 14 inches long and weighs to 1.5 pound. So the eyes and the eyelids are completely formed, and fine layer of head covers the head, and the grasping reflex is present, and irregular movements occur. In 7 months after the conception, fetus is about 16 inches long and weighs to 3 pounds. In 8 and 9 months after the conception, fetus grows longer and gains substantial weight for about 4 pounds. The fetal period of prenatal development marks more important changes in the brain. This stage is marked by amazing change and growth. And that's all about the 3 stages of prenatal period. Once again, the germinal, the embryonic, and the fetal stage. And now let's talk about the teratology and hazards of prenatal development. Let us know what is teratology first. Teratology in dictionary is the scientific study of congenital abnormalities and abnormal formations. So here, the hazards of prenatal is clustered into 4, or not 4, it is actually 5. The first is the prescription and non-prescription of drugs. This includes prescription as well and non-prescription as well. The antibiotic is an example of prescription drug, and that can be harmful. Examples of harmful non-prescription drugs are diet pills, aspirin, and coffee. The second cluster of hazards into prenatal development is the psychoactive drugs. This includes the nicotine, caffeine, and illegal drugs such as marijuana, cocaine, and heroin. Third is the environmental hazards. This includes radiation in job sites and X-rays, environmental pollutants, toxic waste, and prolonged exposure to heat in, in saunas and bathtubs. 4. The other maternal factors such as rubella or German measles, syphilis, genital herpes, AIDS, nutrition, high anxiety, and stress or age, too early or too late, or beyond 30. A mother can infect her child in 3 ways: during gestation, across the placenta, during delivery through contact with the maternal blood or fluids, and postpartum or after birth through breastfeeding. Studies shows that increased stress during pregnancy leads to premature birth and reduced birth weight. It is recognized that maternal malnutrition during pregnancy may result to inadequate growth in the fetus if a fetus does not receive enough nourishment. The rate of cell division is seriously hampered. An extremely deprived fetus may have 20% fewer brain cells than normal. If an infant has been malnourished both in utero and infancy, the brain may be much as 60% smaller than that of the normal child. So, folic acid is necessary for pregnant mothers. Folic acid can reduce risk of having baby with a serious birth defect and of the brain and spinal cord called the neural tube. The last factor for the hazards of the prenatal development is the paternal factor. So, the father exposure to lead, radiation, pesticides, and petrochemicals may cause abnormalities in sperm that lead to miscarriage or disease such as childhood cancer. Human life begins at conception. Human life begins from the moment of conception. All that we have and all that we are have been there at the moment of conception. The fact that you have brown eyes and black straight or curly hair, and the fact that you will turn blood at the age of 50 have been there already at the moment of conception. That what we were added in the process of the development is nutrition. That which is in mother's womb is indeed a developing human being. An unborn baby of 8 weeks is not essentially different from one of that 18 weeks or 28 weeks. From conception, the zygote, the embryo, and the fetus are undeniably human life. The developing being in the womb is a human being, not just a conglomeration of cells and tissues. It is wrong to do abortion, and the womb is supposed to be the safest of all places for human development. Unfortunately, however, with the scourge of abortion, it has become a tomb. So the development that takes place in 3 stages proves that developing embryo in mother's womb is truly a human being.